Hello everyone, thank you for coming to my talk. My name is Anja LEIST. I am Associate Professor at the Department of Social Sciences at the University of Luxembourg, and I wanted to give you a preliminary assessment of long-term care in Luxembourg during the COVID-19 pandemic. I don't have a lot of time, so I'm pointing you to 3 publications which explain in more detail the general handling of the COVID-19 pandemic. Regarding long-term care, this is in Luxembourg in the hands of the Family Ministry, which is in charge of the mission of older persons, including those living in care homes. The Health Ministry is in charge of the management of the COVID-19 pandemic as a sanitary crisis. Other actors were also quite visible. The Association of Care Home Providers, QOP1, issued guidelines directly to the care homes after consultations with the ministries. The National Human Rights Commission commented on ethical challenges. And in general, there were quite forceful policies in place to contain pandemic spread. There were strong infection control measures, particularly in the first few months of the pandemic. When testing became available, care home residents and care staff were strongly encouraged to get tested. And since January this year, care home residents and care staff were also strongly encouraged to get vaccinated. Indeed, these groups were prioritized. And while vaccination of older adults living in the care homes was quite successful, it is improvable from what we see in the care workers who live in Luxembourg. But for the majority of the care workforce, people cross-border commuting from France, Belgium, and Germany. For them, we don't even know the vaccination status due to data privacy concerns. The pandemic impact on morbidity and mortality in long-term care was quite dramatic in Luxembourg. In figures published by the Family Ministry in April 2021, compared to the number of beds, a total of 29.5% of care home residents were tested positive in the first year of the pandemic. Over 40% of all COVID-19 deaths affected care home residents, which is average in a 22-country report led by Adelina Comasereda. And I also wanted to mention that a large share of care home residents infected with COVID-19 apparently died in the care homes, which means that they did not receive curative care, but only palliative care. Concerned about infection clusters in the care homes beginning of this year, the government mandated Jeannot Baringo to lead a working group on this issue. The report was due 2 months after, and the report contains a lot of details, but there is no systematic analysis yet on how infection rates of care home residents may be systematically coincided with testing rates of the care home residents and the care staff, and coincided maybe with the vaccination rates of residents and staff. End of September, the Family Minister presented several additions to a planned law on quality assurance in the long-term care sector, responding to the challenges during the pandemic. And one very good development is that there's now a permanent commission for older people, bringing together all relevant actors to the table in line with the Luxembourg model of consensus. Then there's the Health Ministry, the Family Ministry, Social Security, the Doctors Association, the QOP1 and other actors, which should discuss more, exchange data, and assure quality in the long-term care sector. There are several desiderata to mention. For example, there's no systematic data collection and analysis available at this point in time on the impact of the COVID-19 pandemic on people living with dementia in Luxembourg, on the rates of palliative versus curative care for people in care homes who got COVID-19. And for people in other care arrangements, be it informal or home-based, we don't know anything, as far as I can see, on the infection rates and COVID-19 mortality. Thank you very much for listening, and please feel free to get in touch at the Wild Exhibitor booth via email or DM me on Twitter. Thank you so much.